Hello, I'm Diane Trees. Earlier this year, the World Health Organization announced its first list of 12 superbugs that are on the rise and pose the greatest threat to human populations. Joining us now is Dr. Kevin Sharon, Director and Local Health Officer for Florida Department of Health in Orange County. Dr. Sharon, welcome to the show.
Thank you, Diane.
We've been hearing about drug-resistant bacteria for a decade or more. What is it now with the significance that the World Health Organization issued a report saying that there are 12 top superbugs that might be posing a threat? Is this significant? Is it something that brings concern to you?
Well, I think it's very important that the World Health Organization has issued their report because it helps to organize efforts collectively at a global level so all the countries are on the same page. And you know, the United States and the CDC and our states have had plans in the works for a number of years, and we're really working on the same set of organisms, the same set of bugs, if you will, drug-resistant organisms. But now we have a world plan, a global plan that's going in the same direction. So that's very important.
Dr. Sharon, how vulnerable do you think we are in Florida? Are we any more vulnerable than any other place in the United States?
Well, to the list of 12, they exist throughout the world, and global travel exists throughout the world. So I think for the purposes of our discussion today, and this list of 12 organisms, the bacteria of concern, I don't believe we're any more vulnerable in Central Florida than other countries or other states in the United States.
But we typically hear of a standard segment of the population who may be a little more vulnerable, and that would be the elderly, the very young, people with compromised immune systems. With these anti-resistant bacteria, is it the same, or are we all at risk, or is it just targeted populations?
Well, I think it is true that there are targeted populations. For example, nursing home populations, people who are hospitalized and on ventilators. So people with certain types of respiratory diseases who are at risk of being on ventilators or at risk of having long-term intravenous catheters, people who have cancer, oncology patients. These are examples of targeted populations. And it's true that, you know, premature infants may be on ventilation equipment. Those are situations where these organisms might be prevalent. So yes, there are targeted populations, but for people, you know, walking around in the community, these are generally not situations that are at great risk. Once in a great while, somebody can acquire one of these infections, you know, when you hear of that rare case where somebody receives a cut in the environment, you know, and they end up with a very rare type of Staph aureus or vancomycin-resistant enterococcus, these organisms that are very difficult to treat.
Is there any way to be proactive as an individual?
First of all, keep yourself healthy. What does being healthy mean? Eating right, getting plenty of sleep, you know, having sunshine, having plenty of exercise. We have to keep ourselves well, Diane, and we have to, you know, take care of ourselves. So getting rest, proper exercise, not being stressed out, that's going to help keep our immune system healthy. Not having a high blood sugar level, not being overweight, those are the things that are going to help keep our immune system healthy. If we have an unhealthy immune system, then we have to work with our physicians. We have to have, you know, vaccines, of course, are going to be part of that culture of health. And how do we attain, you know, the prevention levels? So, you know, we have prevention, we have control, and we have containment when it comes to these infections, and I can talk more about that.
What if there was an outbreak in Central Florida? What would the protocol be here? What would you tell the general public?
It is about prevention, it is about control, and it is about containment. The general public would not be at risk, and we would try and contain the infection to wherever it is. So if it's a nursing home, let's say, we're going to try and contain it to the individuals in that nursing home and not allow it to exceed those boundaries. And then we're going to try and contain it to individuals within the nursing home where that contamination has occurred. So then you have control practices for the staff who would be taking care of those patients. That's where the masks, the gowns, and the gloves would come in. Or if there are catheters involved, or if there are respiratory equipment involved, and the sterilization procedures. And then the prevention, you know, people coming into those environments, they would have to glove, gown, and use protection measures as well.
Did we change any of that protocol with anything we learned with the Ebola outbreak?
Yes, I think that both OSHA and the Centers for Disease Control at the federal level and the various states, we learned the higher levels of protection with Bethesda, with Emory, and with Nebraska, the institutions that cared for the Ebola patients. So we know that when we're dealing with the higher level infections, the most critical class, there are higher measures of control. Now, we're not talking about Ebola infection in the particular cases of this list of 12, but we have learned better control measures with wearing those protective gowns and gloves and how we don and doff. What do I mean by that? Putting them on and taking them off. So we've learned better work practice control measures for healthcare workers.
What are the communication lines? How do you interact with other healthcare agencies? Are they mandated to report certain things if it's a suspected case, or does a definite diagnosis need to be made?
Yes, so there is a list of reportable diseases throughout the United States. There's a CDC list, and then Florida has its list. And when we're dealing with outbreak situations, in other words, a higher incidence of a particular outbreak, we'll pick on vancomycin-resistant enterococci, or, a particular type of enterobacter, whatever the organism is. The epidemiology office of the Department of Health in Orange County, they would be notified from these hospitals or these institutions, and then they would work with the infection control practitioners in the institutions to make sure the proper work practice controls and containment and isolation procedures are being followed.
Dr. Sharon, do you think that perception for the general public is that this is a third world kind of problem and not a threat in the United States?
Is it a third world problem and not a threat in the United States? No, it is not that it is a third world problem and not a threat in the United States. We experience these all the time. It is a routine problem in healthcare facilities in the United States, and we have routine procedures and ways of handling it. We call these healthcare associated infections for the most part, and there's different categories of them. Some of them may actually be foodborne infections, to give you an example, and this fluoroquinolone resistant foodborne infections. But each one of them has a classification and a way of handling it. There's the most critical class, and then there's the middle category, and then there's the lower risk category in that list of 12. But each one of them, there are guidelines that exist from the World Health Organization, from the CDC, and within the state of Florida that the hospitals and the nursing homes and the physicians all have guidelines to help follow and know how to handle them. What is really needed is for our industries, pharma, to develop more.
The pharmaceutical companies?
Yes.
To do some research for developing?
Right. So in that top level, the ones that are resistant to multiple antibiotics, that's the greatest concern. So there are some that are resistant to, several antibiotics or multiple, but when they are resistant to all antibiotics, at the very critical level, the top 3, we need research and development to come in and do more. And that's what the World Health Organization is saying, that the countries across the world and philanthropy need to partner together so there is more research and development that will occur.
Interesting. I was just reading an article that there was less, and it was only one article, but they said there was less research being done by the pharmaceutical companies now. And my question would be, I don't know if that's actually the case, but who would do it then? Would it be up to the federal government? Would it be private institutions? And I would imagine funding would be difficult.
Well, it has to be at a global level, and it has to be a partnership, a public-private partnership. So it would have to be both governmental and non-governmental organizations. But across the countries of the world, organizations like the World Bank or private philanthropy or the Pasteur Institute, I'm just giving names of different organizations, as well as, federal investment within this country or the European community. These different groups would have to come together and put some money in the pot. And then the pharmaceutical industries in the world would have to do some development of the antibiotics. So there needs to be development of the antibiotics for the most critical. We've done that, for example, with tuberculosis, but we need to do that, especially with the top 3 in this list of 12. Carbapenem resistant classification. Carbapenem is a type of antibiotic, and now there are a list of 3 that are resistant to the carbapenem.
With the World Health Organization coming out with this list, hopefully that will promote more of a global aspect. And as you said, people are traveling so much. I don't think there's ever been a time where bacteria could be more mobile around the world.
Yes, so it's everybody's business. It's all countries on the earth that can be affected, and it has to be, you know, it takes a village. It's going to take the world coming together on a particular situation.
Thank you for your calmness and matter-of-fact approach to this. Thank you so much.